Hi, I'm Dr. Eric Brokwinski, co-founder of West Coast Family Chiropractic. Just want to talk to you about a common condition that we see in our office: golfer's elbow and tennis elbow. Get a lot of complaints from this, and it doesn't necessarily mean it's just because of golfing or tennis, but can affect a lot of people who do a lot of office work, a lot of mouse work, computers, even weight training and things as well. So a quick anatomy lesson. Let's take a look at, this is our forearm and our hand. It does a couple different ranges of motion. One is called to flex the wrist or the hand. Okay, now when we have all that flexion, all those end up coming to the inside of the elbow, and this is what is known as the golfer's elbow. So as, for example, a right-handed golfer, as they're coming into the ball at impact, it puts a lot of stress into the inside of the elbow, causing a pain or achiness, common complaint again in a lot of the patients I see. When we go into what we call extension of the wrist, or I'll demonstrate it this way, all those tendons and muscles and that come and end up on the outside of the elbow. So this is where, again, a right-handed tennis player, they're going to come into impact, putting a lot of stress into those extensors and causing what they call tennis elbow. Also think of someone who's using a mouse. As they're working on a computer, they put their wrist, sometimes too much flexion, sometimes too much of an extension, causing stress to the outside of the elbow. And a common, again, complaint of what would be diagnosed as golfer's or tennis elbow. So a lot of research out there. What do we do about it? Some people find that they just leave it alone and it goes away. Other people find that it can be quite painful on a daily basis, for a few hours or all day. So what I found to be quite successful is some people during activity would find wearing a brace around the forearm to lend some support to those areas so they don't get too stressed. I also have found that a lot of work I do is trigger point or cross-frictional massage into the areas of those flexors or extensors. This is going to allow for alleviating stress then into the wrist. This can often be misdiagnosed, I believe, as carpal tunnel syndrome. If you picture the flexors of the forearm getting too tight and causing that wrist to flex, it's going to put pressure into the wrist, causing what the carpal tunnel-like symptoms are. So by removing the stress on the arm or in the extensors through these cross-frictional or trigger point massage techniques, it's going to allow those tendons and muscles in that to release, not putting so much pressure. So just a little idea of what golfer's elbow and what tennis elbow does. It can be managed, in my opinion, for most people. If not, then we refer out accordingly to have other diagnostics and assessments. But hope this gives you a little idea of what this is. Look forward to seeing you next time. Thank you.